4 of 550 long days since Connecticut declared a state of emergency over concerns about a novel coronavirus that has become a part of our daily lives. In an episode of the Municipal Voice that aired in March of 2020, we noted that, as quickly as the virus, a lot of information is being spread, some good, some bad. And here now in September of 2021, that still rings true. Joining us to discuss the current state of the pandemic is Trent Joseph, who's the Director of Health for the Town of Madison, as well as the President of the Connecticut Association of Directors of Health. We'd like to thank our premier sponsor, Digital Back Office Palo Alto Networks. Check them out at digitalbackoffice.com or paloaltonetworks.com. The Municipal Voice is the Connecticut Conference of Municipalities podcast in collaboration with WHH LP 103.5 FM. I'm your host, Matt Ford. As always, be sure to give us a like and let us know what you're thinking in the comments. CCM's Municipal Voice podcast continues to present a key forum on important state-local issues. The views expressed do not necessarily reflect the consensus views of CCM or member municipal leaders. Trent, thanks for joining us today.
Thank you, Matt, for having me today. It's a pleasure to be here.
So, the last time we had a director of health on was about a week before the whole state went into lockdown the first time. And obviously, we're going to be talking a lot about COVID and stuff today. But just for starters, can you remind our listeners what a health department does and kind of what your role as director entails there?
Well, Matt, again, just want to thank you for having me here today. And sure, so a lot of people ask, what is a local health director, what a health department does. And put simply, it would be providing the 10 essential public health services, right? So what is that? It's the framework for public health to protect and promote health of all people in the community, including but not limited to assessing and monitoring the health status to identify and solve health problems, right? Diagnose and investigate health problems and health hazards in the community, inform, educate, empower people about health issues. So obviously establishing clear messaging or clear communication around that. Strengthening, supporting, and mobilizing community partnerships to improve the health of your community. And that can be obviously creating some type of channel to personal health services to assure that, you have the provision of healthcare in some areas in cases where it may be unavailable. And developing policies such as like maybe local health ordinances and plans that support, individual and health needs. So there's a list of things that this framework is comprised of, and it's a 10 essential services. So what does that really mean in reality? It means that, the health departments are the ones tasked with providing immunizations to a community. I mean, we play a real big role in immunizations. We play a big role in the health and safety of establishments and facilities used by the public. So we're talking schools, daycares, parks and beaches, restaurants, making sure that, these things are safe for you to attend if you're a resident of Connecticut, right? Barbershops, hairdressers, nail salons.
I think, a lot of us before the COVID would have heard of health departments a lot. Like when you walk in the restaurant, you see that thing next to the door that says A, and they pass, and it's safe. Yeah.
Exactly. So, and it's more than, it's always, public health has always been, the way we look in the perception of the public, right? And we're not just enforcers. It's a large amount of our work is education. And that's a big thing, because you're going to hear me say this again, because education is prevention. And we learned that a lot with COVID, right, Matt?
Yep.
So, getting back to, boots to ground, that's what local health is. We're the people boots to ground. You don't think of it, but we cover a lot of different things, public health nuisances. People give us a call about things that are going on in their properties, hotels, motels, ensuring that those are safe for you guys for people to attend. And being that local health director, you're the captain of that ship, essentially the captain of that ship and how they get into that community. So that's in a nutshell, the long and short of it. But obviously I can build a lot on those 10 essential services, which I didn't finish, but definitely. If they have time, please look at those.
Was this kind of a lifelong passion of yours? Kind of what drew you into public service, but also specifically to public health?
Well, I wouldn't say it was a dream, but rather a goal.
Hmm.
I always wanted to do better at something each time I tried. And that's just who I am. And I came from humble beginnings. Both my parents are immigrants from Grenada. It's
Hmm.
a country located in the West Indies. So living and coming from less, I've always wanted more,
Hmm.
just so I can give more. So that ultimately I became more community minded. Obviously sometimes maybe coming from a little less, there's the hardships and
Hmm.
maybe pain associated with that can turn into wisdom of how
Yeah,
the
you can see
mind
the direct
works.
repercussions of some of the
Right,
policies that you now get to help make and
right,
work with. Yeah.
exactly. So, all that in its sense, it kind of driven me into where I feel that I can impact other people and
Hmm.
change maybe their behavior, maybe the way they think about something, or maybe just by changing that behavior through applied education.
Excellent.
Yeah.
And kind of following up on that, I want to congratulate you because you were recently elected the president of the Connecticut Association of Directors of Health. What responsibilities does that hold, and what is that sort of organization about?
Well, CIDH is a nonprofit organization that comprises of the 62 health districts and health departments in Connecticut.
Hmm.
And so local health directors, again, getting back to the role of what a local health director is, we
Hmm.
are the liaison and essentially statutory agents, of the Commissioner of Public Health.
Hmm.
And we're the crucial providers in providing those 10 essential public health services
Yeah.
at the local level. And for 25 years, CADH has been ongoing. And so being the president of that, it's pretty much representing all local health directors and local health departments and districts in Connecticut, and being that voice and player at the table for, very important conversations and for
Yeah.
policy changes and just ultimately public health.
Yeah. A lot of important conversations at a kind of important time for your field, definitely.
Absolutely.
So, all right, let's get to it. There's been no bigger health story in the health world or the world in general in the last year and a half here than COVID. Um,
Sure.
when we last had a health director on in March of 2020, beginning of March of 2020, it's kind of weird looking back at how little we knew. For questions then were, what is this? And, should we even be worried about it? What was it like to go through those first few months, that kind of first year and sort of this, we got used this word a lot last year, unprecedented situation?
Sure. Well, Matt, wow. There was a lot of unknown, right? There was fear, anxiety, depression, many questions, and unfortunately, many of us lost some people and, close ones. And I think we forget very easily, what that felt like. It wasn't too long ago, but it essentially brought out the best in everyone, in all the partners that we local health had to work with, and
Mm-hmm.
locally all the people that I worked with, because there was a run on supplies. You couldn't get gloves.
Mm-hmm.
Remember, we couldn't find masks, and then
And
we
people were
needed.
sewing them by hand for their friends and
Yeah,
family. Yeah.
exactly. And it was like that for all of us locally. And then thankfully we had some reserves of PPE expired, but it was part of the response. And then,
Mm-hmm.
from there, it was a great deal of just everyone depending on each other, at least locally, forming those partnerships, which I'll talk about shortly. But that's kind of what it was. And it was the best way that you can respond to that type of situation is being well informed and staying
Mm-hmm.
informed, and that's kind of what helped.
Yeah. So Madison, as well as Connecticut in general, after kind of the initial outbreak, has done pretty well as far compared to the rest of the country at flattening the curve, keeping cases down. Why do you think that is? Kind of what's made Connecticut a little bit more resilient than some other places?
Well, I think Connecticut in itself, we're a state with a good infrastructure of health systems. I cannot fail to mention health departments, because
Yeah.
we're the boots to ground, hospitals, and that I think was the effectiveness of Connecticut in the original response. But locally, I can talk about locally. It was really the ability of our command staff
Hmm.
to, keep our residents in our community well informed,
Hmm.
and the continuity of that message. And that's ultimately what really helps. Again, remember, education is prevention, and
Hmm.
clear messaging, and the ability of an individual to be well informed. They're able to be more
Hmm.
prepared to respond to certain things and know what's coming, and that's kind of what we did. And I know we may talk about this shortly, but I do want to say we activated our incident command systems and
Hmm.
emergency operations center here locally, and that comprised of all of the important players in terms
Hmm.
of operations, logistics, planning, and finance, right? So
Yeah.
that's the fire marshal, the police chief. Obviously, first off, the municipal CEO was there on board for Selectwomen Lines, and our fire marshal, our police chief, superintendent,
Hmm.
director of finance, director of human resources, director of EMS.
Hmm.
Everyone was at the table, and
Yeah.
there was a strength of that team that allowed for that clear message and for our community, which happened to be more mobile.
Hmm.
So if you have a mobile community that's able to get out and be more aware and just knowledgeable and cognizant of the threat and
Hmm.
or risk, it really helped with how we were able to respond, and that ultimately played a big part.
Yeah. So it sounds like part of the success of Madison, at least, was that you had some of that stuff in place already.
Well, sure, yeah. So, and then across the state, there is emergency response plan that we all across the state, we are regionalized in preparing for
Hmm.
incidents like a pandemic. So those plans, sure, they provided a framework for us
Hmm.
where they obviously followed to the script. No,
Yeah.
because real time is different than when you're planning and running
Hmm.
exercises. Um, but you know, originally also, and everything is based on at what time in the pandemic we're referring to.
Yeah,
To be
that's very
fair,
true.
to be fair, so
Yeah.
there's a lot that had happened statewide that helped Connecticut,
Hmm.
just remaining informed, and with our Department of Public Health providing,
Mm.
real time information. You can't forget
Yeah.
that the state played a big role, and
Yeah.
Commissioner did as well. So.
Yeah. Speaking of that, kind of the state as a whole and whatever, we're all in this together. Was there a lot of collaboration between your organization, local governments, other health districts, and the state kind of throughout this whole thing?
Yes, Matt, absolutely. It's a great opportunity to mention this on a call, but we formed a local partnership between, Madison and four other towns.
Hmm.
That was, kind of derived from a grassroots relationship that local health directors have. So
Hmm.
it was East Shore District Health Department with
Hmm.
Director Michael Pascasilla, and Guilford Health Department, which is Sonia Marino.
Hmm.
And we obviously we already had a partnership formed to
Yeah.
provide the 10 essential services of public health. And knowing the current trend of the virus, we understood that it's time for our municipalities to at least be galvanized so that we
Hmm.
can better help our communities in a whole. Because big thing about public health, it is labor and resource driven,
Hmm.
and that's a big player in a lot of this pandemic response. So it's better to put resources together, and we ultimately ended up doing that, and that was a big role in forming that. So all the CEOs from the four towns had to
Hmm.
come together, and three health departments and districts.
So since the vaccine has become available, Connecticut has luckily become one of the most vaccinated states in the country. Towns and cities across the state have come up with kind of unique ways to get the word out, to get individuals to be inoculated. How did Madison approach that?
Well, first it would came out, and it was in waves, right? So the
Mm.
eligibility requirements is what kind of drove the initial interest
Mm.
in the vaccine. So if you were immunocompromised and were in a eligible age group, you were considered prioritized. Actually, prior to that, if you were a first responder who
Mm.
was exposed to, or your susceptibility to being exposed was higher,
Mm.
then you were first in line. So I guess, from a community perspective, seeing that the people who are to keep you safe. You see fire, EMS, and police officers getting vaccinated, and that sets a precedent, right? And it's a role, being a role model. And then, the immunocompromised and age eligible individuals, they became interested because they were eligible. And what we did, we had to, through our emergency command system and statewide planning through DPH, we had a point of dispensing for vaccinations and events like this. So we activated our pod, point of dispensing, and we ran clinics out of there in town. And that was originally, it was ran solely by the health department efforts that myself and what I established with the other two. But then again, we had to depend a lot on our town resources. So the director of our senior center, he came on board and his staff came on board, given, So, and we all, it became a team effort, and that ultimately also dictates the role of a local health director, based on the community need. And that's also a big role, because everybody's role can be different based on the community they serve.
And now that we've kind of gotten past that initial, who's eligible at this point, and now it's kind of the people that are holdouts. Is there anything you're doing to kind of encourage some of the holdouts at this point?
Yeah, so there's some hesitancy, right? And that's an important question, Matt, because we look at the current rate and the current trend of the Delta variant, which is obviously a lot more transmittable than any other strain of COVID-19 that we saw or seen. And I think people confuse science with the truth. And science is more so a systematic method of pursuing the truth, right? So if scientists are wrong, it doesn't necessarily mean it's invalidating the method, right? So we forget that science is the most rigorous process in discarding inaccurate ideas. So we have to trust the science, and essentially we have to trust the process. And that's what I try to tell a lot of individuals you see are leading. If you look at the current case trend, it's 20 to 29 who are leading the positive rate, and 2029 unvaccinated, to be clear. And then just put it simply, it's our 20 to 50 20 to 50 year old age group is what we're seeing the common leading trend in the new Delta variant and positive cases. So, what does it mean? I think messaging around it is very important, rather than saying, we have X amount of cases, and these are the people who are unvaccinated, and this is the reason why. I think a messaging of, vaccines do pose a risk, but not a greater risk than having the virus of COVID-19, right? So I think it all becomes a messaging campaign, and because it's education again is that prevention tool. So that's what it is, and it's going to be some time before I think we can convince everyone to trust the process and back to that whole science notion. But ultimately, this is why you wear a seatbelt, right? It's a sense of protection. It can save your life in an accident. It should be the same for, the vaccine.
You are listening to the Municipal Voice on WNHH 103.5 FM. Obviously, you're talking about Delta being kind of the problem more so right now because the pandemic is certainly not over. Our high vaccination rates have kind of kept Connecticut at the lower end of the list, but breakthrough cases have risen. What should the public know about breakthrough cases? Are people being hospitalized at the same rate that they were?
Well, so hospitalizations in the unvaccinated are obviously increasing.
Yes.
And that's, Connecticut, our Department of Public Health, state of Connecticut, they provide aggregate data to us and all Connecticut residents. And that's just a snapshot in time of the current trend. So what to make of the breakthrough cases is the fact that Delta is here.
Mm-hmm.
We're still in this. We're not completely out of the dark here.
Mm-hmm.
And the only way, or essentially the most effective way to protect yourself is by getting the vaccine,
Mm-hmm.
and being well informed. Those
Yeah.
go hand in hand. Definitely go hand in hand. So what can you make of it? Earlier on, you look at it from a year ago, from say now, today, we
Mm-hmm.
probably had somewhere around 5,000 deaths in Connecticut.
Mm-hmm.
Now we're a lot more higher than that.
Yeah.
Just a year later, COVID-19 confirmed cases that are attributed to or deaths essentially attributed to COVID-19. Sorry.
Mm-hmm.
And you look at the trend, and at first it was maybe talking about the data here, right?
Yeah.
Because that's what we depend on essentially. Is it was maybe lower in your minority groups and maybe higher in your non-Hispanic white. And then now
Mm-hmm.
you look at the trend, it's higher in your minority groups, or non-Hispanic, Black, African American, and Hispanic, and it's a lot lower in essentially non-Hispanic white, because it's also reflective of our vaccine percentages and rates,
Mm-hmm.
right? So it's almost if you look at the data, it's almost a complete correlation. But more importantly, you were seeing that the Delta variant is a lot more transmissible. I think
Mm-hmm.
5 times more transmissible than any other variants, and you're probably 16 times more likely to be hospitalized, or at least your relative risk is 16 times more likely, to result into either illness or hospitalization if you're unvaccinated.
So aside from the vaccines, one of the other big issues around this is mask mandates.
Right.
And the Delta coming back has brought a whole kind of new round of mask mandates in town halls and other public venues. Where's Madison right now? Where's your thinking on that sort of stuff?
Well, we recently have mandated masks in all our town facilities,
Mm-hmm.
and as you saw, also maybe parallel to the requirement for educators to be vaccinated. We've requiring masks in our schools, which was a big thing prior to school reopening.
Yeah.
So that's what the current scene is, and we're still recommending masks be worn indoors, and that's another thing I want to mention too, because there's a lot of talk about being vaccinated and still potentially being able to expose someone else to the virus or shed the virus. But that's the importance of mask wearing and all the other mitigation strategies that are in place when you go inside of a building or in a congregate setting. So,
and beyond sort of mask mandates, do you see on the horizon a time when we might have to go back to a full kind of lockdown situation or anything like that?
I probably, I don't know. Maybe the governor's office knows a little bit more than I do about that. But I wouldn't know. I don't think that we can go in that direction again, because we've fully opened, and it'll be maybe a little bit harder to justify given some communities have higher vaccination rates and lower infection rates. So maybe justifying that would be a hard push.
Hard sell, definitely. Yeah. Another thing that's kind of, as this goes on, becoming clear that at some point people are probably going to need booster shots.
Yes, sir.
Kind of based on what do you think that people are going to kind of once again have to be kind of encouraged to go out and get the booster shots, or are people going to show up, and kind of when do you think that all is going to start happening?
Well, there's people have solicited already interest in acquiring a booster shot, from my health department and other health departments. And what do I see? I think if we continue to see a trend and people remain informed and they see the relative risk, I think that the booster is going to play a vital role. And there's going to be there's definitely going to be some interest in there. Whether or not I'm not too sure on, everyone's idea or thoughts
Hmm.
on the booster shots, because I know a lot of people are waiting for more of the science
Hmm.
to be released, respectfully,
Yeah.
um, which is okay. But again, if you are immunocompromised, if you're someone who may be more susceptible to getting the virus, or you work in a particular field
Hmm.
where you're more susceptible, then it'll be to your benefit to protect yourself. And I said that earlier in the beginning, that the better you protect yourself, the better you would be, versus anyone else.
Yeah. So at the top of the show, when we were talking about what you do, you mentioned that there's 10 kind of different areas that health departments focus in. And we've been talking about COVID a lot, but what else do you wish people knew about public health, about kind of the work that you do that doesn't have to deal with COVID?
Well, starting again, I mean, because public health, ultimately, we want to protect and promote the health of
Hmm.
our community. And I know COVID, it goes right down the middle, but there's other things that we do. I mean, we want to assure that we keep a competent workforce, right?
Hmm.
We still want to be able to enforce laws and regulations that protect the
Hmm.
health and ensure the safety. Um, you know, Although it's not directly related to public health, it's related to all the other, chronic or essentially acute diseases that you can be respiratory,
Hmm.
diseases that you can be exposed to. Sorry. Uh, so, I mean, ultimately, we're still the boots to ground agency
Hmm.
that protects the community. And maybe if it's not directly related to COVID, we're just getting back to those more environmental health um, concerns and problems within our own jurisdiction that we have to respond to. So
Hmm.
there's a lot of land use issues that we, maybe need to get back to, and
Hmm.
um, you know, uh, reinforcing of certain codes with other facilities is
Hmm.
going to be very, very important. Um,
Yeah.
so that's kind of where we are now. But
Yeah, I mean,
again,
imagine getting back to some land use stuff. Is there like some stuff that was kind of on your agenda before COVID that maybe got put on hold that you're looking forward to getting back to?
sure. I mean, there's always something.
Yeah.
It'll be hard. It's really hard to say one thing.
Hmm.
There's still global climate change.
Hmm.
There's sea level rise. That we have to be well aware of and
Hmm.
cognizant of.
Yeah, it's a short time, definitely.
Yeah, exactly. And in fact, this is West Wharf. This is Madison behind me,
Hmm.
for the viewers. But that's one thing. And there's maybe more other health education efforts, or maybe just related to COVID, but
Hmm.
there's dental health. And then there's like fall preventions. There's obesity prevention.
Hmm.
Everything is related to your community health problems, of course. Uh, and I mean, I know in some other communities there's still the opioid crisis, right, going on,
Definitely. Yeah.
right, and there's still big lead prevention that
Hmm.
we're all concerned with, and all these things are underneath the umbrella of public health, and again, labor and resource driven is going to be how effective those programs and services are.
Excellent. Well,
Yeah.
Trent Joseph, thank you so much for speaking with us today. We really appreciate it.
My pleasure, man. I appreciate you having me here.
All right, keep up the good work.
Thank you.
We'd like to thank our guest, Trent Joseph. I'd like to thank our premier sponsor, Digital Back Office Palo Alto Networks, who you can check out at digitalbackoffice.com and paloaltonetworks.com. The Municipal Voice is a co-production by CCM and WNHH 103.5 FM. Kevin Maloney is our executive producer, Christopher Gilson is our producer, Harry Draws is on the boards, and I'm Matt Ford, your host. Be sure to check out our Facebook page and give us a like, and watch out for our CCM chat series on our YouTube page.